Hello, I'm Dr. Stephen Prunk, Associate Chief of Pulmonary Medicine and the Medical Director of the Pulmonary Rehabilitation Program at the Hospital for Special Care in New Britain, Connecticut. Pulmonary rehabilitation is an evidence-based program that can help patients with COPD reduce their shortness of breath, take control of their lung disease, and stay out of the hospital, therefore reducing the financial burden to society. Through the integration of physical and occupational therapy, along with respiratory therapy, nutritional, and social services, Pulmonary Rehab's multidisciplinary approach has been proven to benefit the patient as well as the healthcare system. This multidisciplinary approach decreases shortness of breath, improves emotional well-being, and increases functional abilities, like walking, climbing stairs, doing housework, and increasing physical activity. By improving a person's functional mobility and understanding of their illness, that person will gain improved daily control over their life and create an action plan used to treat and manage their disease and their symptoms better. This has been shown to decrease hospitalizations and office visits, therefore keeping patients at home and at work.
Well, I started out being sent to pulmonary rehab by my doctor, and once I went through it, I liked it. So I went to the next program, which was guided by the trainer, and I really liked it, but I felt it was doing me a lot of good, and I wasn't there often enough. So once I went through the training, and the trainer says, you know, most people can't do it on their own because they're not disciplined, but he sensed that I was very disciplined. So I joined on my own, and now I come daily. So I call it my job. I do not miss unless it's something very important. And I find that it's helped me tremendously. Well, I start out with cardio, and I do at least a half hour, sometimes 45 minutes, and I do that as my warm-up. Then I do an hour and a half of the resistance weight machines. I found that it's helped me lose weight. I've quote-unquote bulked up a little bit. They tell me, I don't know. And I'm motivated by it, highly motivated. The more I do, the better I feel, so I keep doing it. Because I'm afraid if I stopped, what the consequences would be, since I've seen the importance of doing it.
Through this program, a person may return to normal activity sooner and in better health. As they adjust to managing the symptoms of the disease, they may see less sick days, improved home management skills, reduced anxiety, and improved depression. With smoking cessation, cough, sputum production, and shortness of breath will improve. The progression of the disease will slow down significantly with smoking cessation, not to mention a reduction in the incidence of lung cancer. Oxygen, if needed to normalize blood oxygen levels, is the only medication proven to prolong life. Pulmonary rehab provides ongoing evaluation for oxygen needs, as well as providing training and education about its use. Pulmonary rehabilitation teaches the reason medications and oxygen are needed for each individual. This education improves medication compliance and proper use of inhalers, which will help decrease exacerbation. All this increases a person's quality of life, making them feel better, breathe better, and live better. In order to enroll in pulmonary rehab, the Global Initiative for Chronic Obstructive Pulmonary Disease, or gold standards of lung disease, are used. These are guidelines that categorize COPD into moderate, severe, and very severe.
Hi, I'm Elise Carroll, a respiratory therapist and the respiratory disease manager at the Hospital for Special Care in New Britain, Connecticut. I'm going to tell you how to refer a patient for pulmonary rehab. If a patient is motivated and able to participate in the program, you can send a PFT or spirometry from the last 3 to 6 months showing moderate, severe, or very severe COPD. The last office notes are important as well. They need to show medical stability and the patient can walk even just a few feet. Cognitively, the patient must be able to follow directions and understand and be able to carry over all the education that is provided. There are many parts to a comprehensive pulmonary rehab program. One-on-one sessions with physical, respiratory therapists, and occupational therapists will help patients navigate stairs, handle uneven surfaces, and learn how to use adaptive equipment. Additionally, things like shopping and grooming can be shown to the patient while they reduce their energy conservation but do things with less short of breath. The respiratory therapist will help them with body positioning, proper breathing, and titration of any oxygen that they may need. There is a monitored group exercise where a ratio of 1 therapist to every 4 patients is achieved. In this fitness center, the patients are monitored closely. Additionally, educational topics with the goals of self-management for the patient are given. These educational sessions include how to handle having lung disease, the anxiety and depression, how their lungs work, and what their lungs do when they get sick, how nutrition can help with lung disease, advanced directives and goal planning, and disease management, all with the goals of self-managing and less exacerbations. When considering a good pulmonary rehab program, there are many things to look at. And as a physician, you want to make sure the programs have good outcomes and a reputation that is probably what you might look for. It also must include smoking cessation counseling. For a patient, they may need to consider things like easy access to parking, easy access to entrances, and ongoing exercise maintenance offering, as well as social support. Medical insurance does cover pulmonary rehab. Medicare covers pulmonary rehab, and most commercial insurances follow Medicare guidelines. This is a one-time, lifetime benefit covering up to 36 sessions, but to a maximum of 72 with medical necessity. Medicare does require that physician-prescribed exercise is included, and each patient has an individualized treatment plan, along with psychosocial assessments and the education and training related to the individual treatment plan. In summary, this is a covered benefit that no patient with COPD should be without. Better breathing, better living through pulmonary rehab.